Um, Most of what you learn in first aid is not something that you necessarily need in the medical field, but it's something that's just good to have in general and know about. Um, a lot of times when you hear about first aid, one of the things you learn about is CPR and life-saving skills. Those are not something that I'm going to really go through today because that in and of itself is a whole class and it will take a long time. If you are interested in learning about CPR, places like the Red Cross will teach classes. And something that where I learned a lot of some first aid things actually was in a babysitter course that first aid stuff that is taught by the Red Cross. And so if you're ever going to be around a lot of little kids, that's kind of a good place to start also. But where I'm going to actually start is showing you my first aid kits. I have one that I keep in my car, and then I have a whole bunch of them that I keep in my house. I kind of went a little overboard, but I do have children, and everybody kind of has their own little needs, and so that it kind of changes person to person. But my first one I'll show you, is the one that I keep in my car or in my purse. And honestly, I'd say the stuff that I put in my first aid kit for my car is what I think is more important to have around all the time. But I'll show you what's in here. And first, and what I think is extremely important is to keep your hands clean. Whenever you're doing anything with first aid, is you should always have your hands clean. So I always have a pack of wipes that I keep in there. You can get them in different sizes. There's little individual ones or a pack that's big. I also have all sorts of different sizes of Band-Aids. And my favorite that I have found over the years is actually Walmart's Equate brand. And they have Neosporin already on them, so you don't even have to pick up, like have an extra tube of Neosporin with you. But I keep all sorts of different sizes with me in there. And then just big ones, because you never know when you're out. It's just kind of good to be prepared. It's also good to keep the wounds clean. So if you get hurt and you need to clean it, I always have little alcohol swabs with me, and I will say that these burn. So it's not like ideal, but it will do the job and it will get it clean. And then I always keep like a little thing of Tylenol in there, or Advil is what we keep. I don't keep many children medications with me. I've found that I don't really need them. And so in mine, I don't have it. And then on this other side, which I keep zipped closed, I've got Benadryl. I always just keep one little thing. And then in most first aid kits, they will come with these little guides, which are really helpful if you kind of forget something, because when you're in the moment and you're kind of panicking because you get hurt or somebody else does, you might forget something. So those are always good. And I go ahead and keep those in there. Gauze pads are in there, and they're really good. And because I go a little crazy, I always have a pair of scissors in there just to be able to cut it if it's the wrong size. And that is basically what I keep in my car one. And like I said, I really think that's kind of the most important stuff to have on hand. But, you know, just keeping your hands clean and then being able to put a Band-Aid on it, and like while you're out and doing things real quick, is really like the best thing you can do. Because the purpose of first aid really is just what they say are the 3 Ps, and that's to preserve life, just to kind of, you know, help somebody who needs intervention at the moment to try to save lives, prevent deterioration, just kind of keep somebody from getting worse. And then also to promote recovery. So you want to make sure that if somebody gets hurt or you get hurt, like you keep a wound clean, because you don't want it to get infected or get worse. So then I will go into, wrong computer. I will go into what I keep in my first aid kit in my house. So I keep mine in these because I find that I can get them in and out easier, and I label them so that way my kids know where they are and my husband knows what's in them. But really, it's the same thing that you'll find in my smaller one, just in bigger sizes of everything. And I stick with off brands, so it doesn't matter whether you do Band-Aid brand or you do any other sort of brand. I do add a couple other things that I don't keep in my car, and that's for colds. You know, so if you're sick and you need like NyQuil or you need Sudafed or Mucinex, the last thing you want to do is to run to the store when you just feel terrible. Is to have to get in your car or have somebody take you to go get medication, but just to have something that's really quick and on hand. And like I said, I always do off brand because it really doesn't matter. And it's a lot cheaper to be able to keep it on in stock. And another thing I think that's very important that I don't keep in my car is a thermometer. And it's fine if you use the thermometer under your arm. And if you do take your temperature under your arm, you do it the same way you like in your mouth, and you stick it under your arm and you hold your arm down, and it will be about 1 degree lower than if you were doing it in your mouth. But it kind of prevents you from spreading germs and just makes it a little easier. But if you call the doctor because you are sick and you need to tell them what your temperature is, you want to tell them how you took your temperature, because it does, like 1 degree can make a big difference in what the temperature comes out to be. So they'll usually ask you, or sometimes they'll ask you how you took it, and that's why. So now I'll go into like how to actually do some of this stuff. So little lady there on the right who has fallen and probably scraped up something. The first thing you want to make sure you do is to make the bleeding stop. So you want to put pressure on it and keep it to where you get the blood flow to stop. You don't want to have it still bleeding when you remove your hand. So sometimes it takes 10 minutes, and honestly, sometimes it'll just kind of be bleeding just a tiny bit and you don't really need to apply pressure, but just make sure it's not. And then you want to clean the wound. And my favorite way to clean wounds, what we have found, is just to use hydrogen peroxide. It does not burn, and it will clean it quickly. So I usually just pour a little hydrogen peroxide, and then we'll after that just rinse it off, pat it dry, and then you can put your Band-Aid on or put a little Neosporin on it. But you want to make sure that you change out your Band-Aids if they get dirty. And then you want to watch for any signs of infection if you've got like a deep cut. And so a lot of times those signs of infections can be that it just isn't healing quickly, or maybe it doesn't turn like the light shade of pink that it should after a few days. It stays really red, or it starts looking really nasty. And if it starts looking nasty, then it's time to call a doctor at that point. Another thing with burns, you know, you're carrying your coffee or you've got soup and you spill some on your hands. You want to make sure that you get it cool. You want to put it under cool water. You don't want to do cold water, and you don't want to do warm. If you do those, it can cause a little bit more damage. You want it to be cool, and just let it sit under there for a few minutes, or get a wet paper towel and set it on there. Sometimes the breeze or just wind blowing over a burn can really hurt. So if you can just get like a cool paper towel and set it over it, you'll be good. One thing that I have heard a lot of people say is to put butter on burns. Don't do it. I don't know where this came from, but do not put butter on burns. Just put the cool Band-Aid or put the cool towel on it. And then after it doesn't hurt quite as bad, just put like a loose bandage. If you do it too tight, it will hurt, and you don't want that. After a few days, maybe even that night, a blister will usually form on your burns. Just leave those alone. They'll kind of pop or fall off on their own, but that's your skin trying to heal itself up underneath, and it's trying to protect it from any bacteria or, you know, anything trying to get in there that you don't want, and you don't want to end up having to go to the doctor over something like spilled coffee on your hands. So just leave it alone until it starts getting better. And the same as with the cuts, you if you see that it's not turning pink, or you see that it starts like having some nastiness looking to it, like starts oozing or has any pus on it, then it's time to try to get a hold of a doctor at that point. And sometimes that means you can go to a walk-in clinic or you can call your physician. Sprained ankles. This is something that happens to me quite frequently, and probably a lot of people that are rushing around really fast. The best thing you can do for a sprained ankle is just rice it. So you rest it, you ice it, you compress it, and you elevate it. So basically what I do is I grab a bag of frozen corn out of the freezer, because it's heavier. Like, it feels good when you put that on there, but it also can like wrap around your ankle really well. And you set it on there, prop your leg up, and it will usually start feeling a lot better. If you feel like you broke your ankle, then you can go to see a doctor. It's not something that you need to go to the ER about. It's something that you can just go over to a walk-in clinic or your normal physician. But it usually can take up to 24 hours before a break will even show up. So sometimes if you go straight to the doctor right after it happens, they may not see anything, and they might tell you to come back in a few days to try another x-ray. So it's usually I'll wait till the end of the day. If it's not feeling any better, that's when you go do your x-rays. So insect bites. If you have a stinger that is in there, so you've gotten stung by a wasp or a bee, you want to make sure you get that stinger out of there. Otherwise, it's just going to cause infection. It's just going to be really uncomfortable. And then you want to make sure you wash it with soap and water. You kind of scrub it. It kind of feels good sometimes if you have a bug bite and you kind of scrub it with soap and water at the same time. It's kind of like, scratching your arm, but don't scratch your arm. So it's kind of like being able to scratch your arm at the same time. And then you want to put a cool compress or just something that kind of is on the cold side, because it will help with the swelling and just kind of help it feel a little bit better. You can use some topical medications. I have one that I use occasionally, or hydrocortisone cream, just something that can, numb the spot. Usually with like mosquito bites or something, you don't need anything. You just really want to try to avoid scratching them and leading to other issues. Sometimes people can end up with allergies to like bee stings or wasp stings. So if you get hives or you feel like you're having difficulty breathing, or your face starts swelling, that's when it's time to get over to your urgent care, or if it's really bad, 911 and get into the hospital. Am I going too fast, Sandy? Are we good? Okay. Nosebleeds. Okay, so this is something that I've had nosebleeds my whole life, and so my poor children get nosebleeds all the time. Certain times of the year, your body's more prone to getting them. You run into something or you get knocked in the face, you may end up with a nosebleed. And something that's really important to remember is when you get a nosebleed, never lean your head back, because when you lean your head back, the blood flows back down your throat and into your stomach and can cause a lot of people to start throwing up. And so you want to sit up straight or lean slightly forward while you do this. And you want to pinch your nose and you want to hold it for like 5 minutes until the bleeding stops. And sometimes it doesn't stop after 5 minutes, and that's okay. Keep holding it. But usually it doesn't take longer than 10, 15 minutes for it to stop. And if you go a lot longer than that, then you can call your physician. But I've never dealt with one that lasts longer than that. So it's pretty uncommon that it would go for that long. But usually you can make it stop just by holding pressure on it. But make sure you do it continuously. Don't keep doing it up and down. And then head injuries. These are kind of where people get a little bit worried. If you knock your head or it can be nerve-wracking if you fall and you hit your head. One of the main things to kind of keep in mind with head injuries is you have a lot more blood flow in your head. So it will look like it's bleeding a little bit more than maybe if you like scratch your arm. So kind of with all the other scrapes is just kind of apply pressure till it stops bleeding. an ice pack to the injured area. And this is more for like minor injuries. And sometimes you'll end up with a little goose egg, a little bump. But if it's bigger than 1 inch round, then that's when it's time to go over to your doctor and get treated. But typically, most head injuries are fine. If you lose consciousness, just even for a few seconds, it's good to call your physician just to talk to them. I'll give you an example of one of my children. When she was 1, she was very active, and she was sitting in her high chair, and she started like bouncing and somehow ended up at the table, put her feet up on the table, and without us even noticing, she pushed it back and flipped the high chair backwards. And so when she ended up flipping and landing on her head, she started throwing up. She didn't lose consciousness, but she did throw up. She was having a hard time staying awake. And so we ended up having to take her over to the doctor and have her looked at. And she's kind of crazy. So she ended up running through the bathroom the next day. She slipped and fell. And for a whole week, the poor child had to run around in a helmet every time she played after that. But so even someone little tiny flipping, it's not always super dangerous. It can be very dangerous, but it's something that if you're even remotely worried, to call your doctor. And so we went and we saw our physician. He didn't tell us to go to the ER because she did wake up. She was able to like look at us, and she was able to kind of communicate in a way a 1-year-old should. So we were able to go to the doctor's office with her and not to the ER. If you are by yourself though, and you feel very dizzy, or you feel like you can't like communicate like you should, or what, like if you just are even remotely questioning it, that's when you should call 911. You don't want to end up driving somewhere and end up in a wreck because you were worse than you thought. So fever and illness, this is one I was kind of skeptical on really touching on, but I think I should, just because of coronavirus. So I will at least touch on this. So if you have had a fever in the last 24 hours, or if you've had a fever at all, don't go out. If your fever has been gone for more than 24 hours and you've not had to take any medication whatsoever to get it to go down, that's when you are considered to no longer be contagious with whatever you've had. Sometimes there are other things that may take longer than 24 hours, but the standard rule is once you've been fever-free for 24 hours without medication, then you are good to go out. A low-grade fever is any temperature that falls under 101. And with a low-grade fever, there's not much you can do for it. Drinking lots of water and resting is really the best thing you can do. If you run a fever over 101, that's when you start taking your medications like Tylenol to kind of reduce the fever, just to kind of help you feel more comfortable. If you have a temperature that lasts for a few days, like 2 or 3 days, over 103, that's when it's time to go see your doctor. Sometimes it can be something that's a little bit more serious than just a regular cold. If your throat is swelling, if you can't stop vomiting, if you've got a severe headache, if you've got chest pain, a rash, stiff neck, that's when you also need to go visit your doctor. They can give you some sort of medication that can help you feel a little bit better if it happens to be something like strep throat. So a cough. Right now, the cough is like the big thing that everybody's talking about with coronavirus. With that, it's this really deep cough, but it's not productive. Usually, sometimes, in a lot of cases, you'll end up with a cough that is productive, and you can use medications to help with those. The best thing to do when you have a cough, though, is drink lots of water. If you've got a lot of like stuff down in your lungs, drinking a lot of water will help like loosen that up. So drinking a whole lot of water and resting. But stay home. Also, that's the big thing right now, again, with coronavirus, but also just with illnesses in general. You really don't want to spread anything. So it's best just to stay home. But call your doctor if you're ever curious, if it's something more than you think it is, if it's lasting a really long time, you just feel crummy and you're just not getting better. It's good just to kind of call your doctor at that point. So there, like I've been mentioning before, all these different medications you can take. You want to always follow the instructions on the back of medications. So some of them will give you instructions that if you're a certain age, take a certain dosage. If you're over a certain age, you take a different dosage. Follow them exactly how they say, because you don't want to end up having more issues because of taking too much. If a doctor gives you an antibiotic, finish the full course that they tell you to. That's where your superbugs are coming from, as a lot of people aren't finishing their antibiotics like they're supposed to. They think they feel better, so they stop and they'll just save it for the next time they get sick and they can take some then. But it's not how an antibiotic is designed to work. It's designed to be finished in the amount of time the doctor says to take it. Always check the expiration date on your medications. A lot of times it'll just be itty bitty down in a corner, but you always want to check it and make sure that it's not expired. Most medications really will just start deteriorating and won't be very useful at that point, but it's still good to just follow the date on them. If you ever have any questions about medications, whether you're at the pharmacy or whether you're home, pharmacists are always willing to answer questions. You can call and ask them just about anything. I've got a kid who can't take a lot of medications. And even on like our kid box, we have written on there to make sure that he doesn't take anything that's in this box other than Tylenol, just because he can't take anything. And so we're constantly talking with our pharmacists about medications, and they're talking with the doctors, and they're a great resource just for anything. And a lot of times they can even answer like first aid questions if you're there and you're trying to pick up stuff to put a little first aid kit together. They're very helpful with just trying to lead you in the direction of what's good and what you should have in there. Try to stick with the same pharmacy if you can, the same pharmacist or the same like group, whether it's like Walgreens or Publix, because they kind of have a database that they can keep all your allergies listed in there, and they can see what medications you're taking and see if there'd be any drug interactions with those. So one area that a lot of people struggle with is knowing when to go where. And this is something that I sometimes am like, I don't really know, but most of the time, walk-in clinic urgent care can handle most things. So if you have a cold or a fever or feel like you have the flu or a UTI or some sort of skin condition, or you even just have a cold that you just feel like you need to go to the doctor about, usually a walk-in clinic or urgent care is a great place to go. If you don't have a general practitioner and you need to get a checkup, your urgent care or walk-in clinics are available to do those. You want to save the ER for things like seizures and vision loss and somebody that's passing out, or somebody who's, having difficulty breathing. You want to save the ER for those kind of trips to not clog up the ER when there's people that really need to get in there. If you're ever in doubt, then it's a good place to go just in case. But if you really, like if it's something minor or you fall and you break your arm, urgent cares can usually handle those things. But you can always call ahead and ask them if you should come there or go to the ER. And sometimes they will direct you to go over there, because not all urgent cares can do x-rays. So sometimes they'll tell you where a better place to go might be. It's always good to keep a list of phone numbers with you, like poison control. In case you swallow something or you take a medication and then you look on the back and you're like, oh my goodness, I accidentally doubled the dose I was supposed to take. And you can call poison control, tell them what you took, how much you took, and they can direct you whether there's something you need to take at home, whether you need to call your physician, or whether you need to get to the ER, and they can direct you on what to do. I keep the phone number stored in my phone. I also have one on the cabinet where we keep our first aid kit. Um, and it's also got a list of all of like our important phone numbers. And I usually keep our dentist and our primary care physicians. Yeah, thank you. The phone number. And so it's good to keep that phone number like handy. And, even if like you're cleaning a bathroom and all of a sudden you've mixed two things that you shouldn't have mixed and you smell something funky or you see a smoke forming, you leave the bathroom immediately and you go call poison control. It is an extremely helpful number to have around that we have called on numerous occasions. And they can always help you figure out like what the next step is going to be when it comes to those things. And I know this was information overload. Okay. So this was a lot of information packed into probably a short thing. And I've probably just like rambled really fast. But basically, what I want you to get out of this is that it's good to be able to take care of your minor wounds on your own at home. And so if you can keep Band-Aids, Neosporin, some sort of pain reliever like Tylenol or that can reduce your fever, if you can keep those with you, that will save you a whole lot of trouble. Even things like Benadryl to have on hand in case you get stung or you break out in hives or something, just to have on hand. And keep it portable. Keep it all together like in one location. So that way, whether you are going camping or you are going for a hike or you are just getting in your car to go somewhere, you always have something with you. Back before I used to really make this, I always kept at least like 2 or 3 Band-Aids that had Neosporin on them in my wallet, just so that way I always had that. And I always found that I needed them, whether it's like a paper cut or something. It's good just to kind of have that with you. It's good to just have a basic knowledge, and just as long as you've heard it at least one time, then if the situation arises, you may not feel as panicked as you might. You can always kind of go back and look up information. It might kind of, all of a sudden something happens and somebody gets stung by a bee. And you just, you're like, well, I heard this at some point, and you can think back like, what was I supposed to do? You can buy kits that are already put together if you want. Typically, they're a little bit more expensive just for the convenience of it. But you can buy kits that have everything in them that you need. And I think that is basically it. The only thing that I'm seeing now that I did not mention because it fell out of my kit just now is this may seem silly, but I have found this extremely useful. I always keep gallon-sized bags I keep one in my car and I keep one in my first aid kit in my purse, because we always have somebody that will throw up or somebody spills something on themselves. And it's good to have a Ziploc, like a gallon-sized Ziploc baggie just for those kind of cases. So that's the only thing that I'm seeing here that I forgot. Does anybody have any questions? I know that was a lot of information in a very short amount of time. Does anybody have anything they want to ask?
I have a couple questions.
Okay. No, go for it.
You mentioned Advil and Tylenol kind of interchangeably. When do you recommend, or do you recommend a certain time to take one over the other, or is it just your own personal family preference, or which one's better for certain things?
I tend to stick with Tylenol or acetaminophen, just for like personal preference to have on hand at home for fevers, because I found for me that works better. But my husband really likes Advil when he gets a headache. So I think sometimes it's just personal preference. My grandfather was a pharmacist, and so most of what I do with medications happens to come from just what he always told us to do. And Tylenol is what he always told us to use. And so I just kind of stuck with that. And so I usually keep Tylenol around for me, but my husband likes Advil. So I guess for that, it's kind of personal preference. So.
You also, when you were talking about the burn, some people will say to put something else on it, like an aloe or something. Some people don't. Do you recommend not putting anything other than the cool, not cold or hot, but the cool water and the loose dressing? Or is there something that you could put on it too that would help?
I think it all depends for that on exactly the extent of the burn. If it's like a sunburn, like aloe will help. If you burn your arm on like the oven and you kind of broke the skin, I usually let it dry out a little bit and then eventually put like Neosporin on it. But I don't always put anything on it. I guess it kind of depends. The really deep ones, I've burnt myself pretty bad. It's usually on the oven, pulling something out of the oven. I'm a total klutz, so I frequently get myself hurt. But a lot of times I keep the cool compress on it for a really long time until the pain kind of starts going away. And then usually just for me, I prefer to put a Band-Aid on it at first. That has, like, I keep going back. It's those, let me see if I can find the package. And see, it already has like an antibiotic ointment on it. And a lot of times that's just to kind of help prevent infection from setting in, is why you put something like Neosporin. It can also kind of be like putting Vaseline on it. Some people say to do that because it kind of helps cool it. And I guess that's kind of personal preference. I've kind of read both ways to put Neosporin. So I do it sometimes, but I don't always do it. And so I might need to look more into that one, but sometimes I do it, sometimes I don't. Just don't put butter on it. I don't know where that came from, but I have been told on multiple occasions to put butter on it from family members. Don't put butter on it.
I've actually heard that too. Can't it make it worse?
Yeah, I think it can. I don't know exactly what it is. It's probably like the oil in it, or I don't know. But I know I was always told, and I remember even in nursing school, them saying there's a lot of like old wives' tales out there of things that you can rub on, but don't do it. Like usually Neosporin's not going to hurt to put it on there, and so you can. But all I can imagine is just like if you put butter on it, it's just going to end up this greasy mess, and you'll probably end up just like just putting bacteria down into an open wound. So I don't see that as being helpful at all. So
you also mentioned the rice, the icing, a sprained ankle and or a break after you've been to the doctor. I've always heard you could rotate that with heat. Is that true, or is that again a personal preference?
I don't know about heat. I've always been told to stick with ice. It will help with the inflammation. Heat, I've heard with muscles, it will help relax muscles. But the ice is going to help you with the swelling. Okay. So I guess if you've pulled like a muscle, you've done something like that, then, you've been running and you feel like you pulled like a hamstring or something, then I could see doing the heat. Okay. But ice usually helps with the swelling. So.
Awesome. You mentioned drug interactions.
Yeah.
I know what those are, but I'm going to pretend like I don't.
So okay. Okay. Sorry. I guess I should have explained what that is. Okay. So drug interactions are where you take multiple medications at one time, and they should not be taken at the same time. And even something common like there's a lot of cold medications that will have, I'm trying to see if this one does. There's a lot of cold medications that will have Tylenol in them. So you want to make sure that you don't take like that cold medication and then also take Tylenol, because then you're doubling up your dose of your Tylenol, which can end up causing some liver issues. So with things like that, you don't want to double up. There's really good websites out there that can help you, and you can look it up. There's some medications that you can't take with certain foods. You can't mix with milk or grapefruit juice. There's certain ones that you can't do with grapefruit juice. So it's good to kind of look those up, or again, call your pharmacist if you're worried about multiple medications. And typically I won't give more than one medication to anybody. You could usually take like an antibiotic and Tylenol at the same time. But if it's anything beyond that, I usually ask, call a pharmacist, or I look them up myself just to make sure that it's something you can take together. Sorry, I should have mentioned what exactly that was
Fine.
earlier.
One thing I've recently learned, and I should have known this a long time ago, but a lot of people will take several different vitamins or supplements at the same time. And while
Yeah.
typically that's okay, sometimes they have an interaction with each other as well, or
Yes.
your medications that you're taking.
Yeah. Like, so, the only thing, see, I did a lot of things with the heart. So that's most of what I can remember. So there's a lot of medications out there that will, like lower your heart rate or will lower your blood pressure. And so if you take multiple medications that kind of do the same thing, you really don't want your heart rate and your blood pressure to drop even lower. You're talking about your multivitamins. Like there's, like with calcium, you don't want to take medications that you can't take. Sometimes the reason you can't take certain medications with milk is because of the calcium. And so if you're taking like a Tums, which has calcium in it, with medications that you can't take with milk, you may end up having an issue. So that's when it goes back to being, whenever you get a medication from, even like whether it's something you buy at the drugstore just off the counter or over the counter, or you get a prescription, it's always good to read the back. And a lot of medications will even tell you on the back, don't take this if, you're on this medication, especially prescriptions. They'll do a really good job of listing what you can take and what you can't with it. So,
Another thing, when you're at the doctor's office and they ask you all the over the counter stuff that you take and
mm-hmm.
or medications, I have learned that it's very important to make sure you do list everything. Even if you're like, I just take a vitamin B supplement, they don't need to know that. Well, whatever
Right.
they might end up prescribing you could interact with that. So it is very
Yeah.
I've learned.
It's always, it's important to, and if you have a lot of medications that you take, it's good to make a list of them to give to your doctor when you get there. So there's some people that do take a lot of medications and they should give them to your doctor. So my kids, I have a list. So my one son, there's a lot of medicines he can't take. And so I have a list of medicines that he does take and ones that he can't take and stuff that we take in to the doctor every time we go, just to like make sure that we're on the right track. But I also, he'll add things to the list every now and then and just be like, this is something you shouldn't take. And I'll write it down real fast, just also for my own memory so that I can remember, because sometimes it's easy to forget all of these different ones. But yeah, you should tell them, even if you take, like they're being, young, I don't expect anybody here to be taking a daily aspirin, but there's occasionally people that do. So even if it's something little like a daily aspirin, a multivitamin, a little chewable multivitamin, it's something you should always tell the doctor that you're taking, just so there aren't any interactions. Or maybe you're taking one that has too much potassium in it, and they're noticing your potassium levels in your blood are high, and they can't figure out why, but you didn't tell them that you were taking a multivitamin. So there's a lot of reasons you should always tell them everything that you're taking.
Thank you. Does anybody else have any questions for Miss Caroline? Jake's like, nope, no question.
It's a lot of information. It's, when it comes to anything medical, it's a lot, and it's a lot to take in, and it can be overwhelming. But there's a lot of really good resources out there that you can look up online. There's a lot of like free online first aid lists that you can print off, or first aid kit lists, like kits that you can get. And a lot of times, like I said, it can be personal preference. And so it's, you find what you like and what you don't like, and you kind of go from there. But Sandy, I did look up your heat real quick. And what I'm seeing is that you don't want to do it while your ankle's still swollen. Like if you do a sprained ankle, you don't want to do it while it's still swollen. It increases the blood flow, so eventually it can help with healing, but you don't want to do it early on. So yeah.
Well, guys, if you do want more information, or maybe there was a topic that Miss Caroline covered and you're like, I want to know more about that, or if you want to take any CPR and first aid classes, you can find it at the redcross.org, in addition to there are lots of other places like Caroline mentioned. But I put that website address in the chat box along with the poison control number for your reference. And if there are no more questions, I think is that it, Caroline?
That's all. That's a lot of information. So
It is for sure. And
yeah.
so I bet that if you do have more questions later, if you want to contact me via email, I can get them over to Caroline, or I can help you get answers to that as well too. So I think that's it. I'm going to stop recording.